So, Naresh Rati, Executive Partner at the Vitality Partnership, thank you very much for coming and talking to us. And my first question is, what is your vision for patient care within the Vitality Partnership?
The Vitality Partnership currently serves a population of about 40,000 patients in inner city Birmingham. And our vision is to create a large, fit-for-purpose primary care organisation that can deliver high-quality patient care to our population, and also to expand and deliver some of the services that are traditionally sat in secondary care in the community setting. So we want to try and achieve a base population of about 70 to 100,000 patients, which will allow and facilitate a lot more integration of services within our community.
And when you say fit for purpose, what kinds of things will make you fit for purpose in the future?
Patients, when they walk into their GP practices, want to see the GP, their GP at a time and convenient to them. However, we recognise the pressures that in primary care with the new legislation and the targets that we have to hit. So sitting behind that is a very corporate looking organisation which manages the finance, the business side of it, the governance side of it, and so improve the quality of the care that we deliver.
So we've been talking today about how generalists and specialists can work together. How have you been able to engage and work with your consultant colleagues within the partnership?
We found that historically the relationships between GPs and consultants are built on who you know, personal relationships, etc. And it must be very difficult for consultants to sort of work their way through this new minefield of legislation that's going on, CCG groups and practices, etc. And by having a very large, strong local organisation who are fully committed to working with our local consultants, we found that that is the best way forward. So I'm more than happy to get on the phone and sort of say to individual consultants, will you come and talk to us? And they do, because they know who Vitality are.
And what are the success stories of the collaboration so far, and what kind of benefits have they delivered for patients?
We see very much that our model and vision is one of integration with our local providers rather than competition. And by doing that, it less destabilises our local acute provider. And so one of the key successes is our rheumatology service, which is developed in collaboration with our local foundation trust. We've recruited nurse specialists, we have SLA agreements with our consultants, and they come out and support our gypsy and nurse specialist clinics.
Okay, and in terms of the benefits that delivers to patients?
We found that the majority of patients that access care through this service are seen much quicker, they're seen more local, and they're seen by clinicians who understand the level of complexity that they face. And when they need to, they have ready access to a highly skilled specialist.
And what do you see as some of the barriers towards barriers to this kind of collaborative working?
We've had to adopt a bottom-up approach, so speak directly to the consultants, and we found that that's the easiest way to sort of collaborate. When we've tried to go directly to the chief execs or the boards of the foundation trusts, the local foundation trusts, and through our PCTs, there's a whole heap of bureaucracy barriers that you just have to try and navigate through. It's much easier just to go directly, and we are very grateful for the support that we get from our consultants, despite some of the barriers that they face when they go back to their trust to sort of say, this is what we want to set up with Vitality.
What plans do you have for the future in terms of joint working between GPs and specialists?
Our ultimate vision, when we reach a population of 100,000 patients or so, is to become an accountable care organisation where we'll be working in partnership, in collaboration with our local consultants in a vertical integrated manner, and also with our community providers, our community nursing district nursing teams in a more horizontal, integrated manner.
And are there any specialisms that you're likely to move into next?
So our focus to date has been on our, the specialities that we currently internally amongst our GPs have got interest in, so dermatology, rheumatology and gynecology. Moving forward, we are training up GPs to become the future GPs with specialist interests in a whole range of outpatient services, cardiology, orthopedics, ENT and gastroenterology. And we're working alongside our local consultants who are supporting all these gypsies in training, so that as we grow we can take on more services back into the community.
And are there any specific changes that you think that are needed in either policy or regulation or funding systems that would help you to achieve your vision and goals?
The current system in terms of payment by results and the tariff system goes against what we're trying to achieve. Commissioning and the CCG groups, we're not sure where all of that will fit into this model, and also in terms of the accountability. So there's still quite a lot of uncertainty. We know where we want to get to, and we're trying to navigate through the system, which is an ever-changing sort of, the goalposts are continually changing around this. But I think we know where we want to get to, and we're just trying to sort of carry on